Hey, my friend, would you like to know all the environmental conditions that may be affecting your heart health? On this show, I bring on an expert who founded the field of environmental cardiology, and he shares with you how the circadian rhythms or day and night rhythm could be having an impact on your heart. Also, he shares how the zip code that you live in could be having a major impact on your heart, positive or negative. And he also talks about how the personal choices that you make, be that with the food you eat, the exercise that you get, or smoking, vaping, and others, could be impacting your heart health. So stay tuned for an amazing episode where we go into what's causing negative effects to your heart, but also what you can do to have a healthy heart that allows you to live a long and healthy life. If you're looking to get thicker, fuller, and stronger hair, I highly recommend you check out fullyvital.com. We've come up with a natural set of products, 100% natural, that allow you to stimulate your hair growth in multiple ways. 4 ways, from the inside and from the outside, to grow thicker, fuller, and stronger hair. So check out fullyvital.com for hair health. If you're enjoying the content on this channel, then please make sure to hit the subscribe button down below so you can get notified when we release new episodes. Our goal on this channel is to give you practical tips that you can use to slow down your aging and look and feel younger and live your most adventurous life. So make sure to hit the subscribe button down below so you can get notified. All right, let's get right on with it. Hey, my friend, welcome back to the Anti-Aging Hacks podcast. Today, my guest is Dr. Aruni Bhatnagar, who's the Smith and Lucille Gibson Professor of Medicine, director of the Christina Lee Brown and Envirome Institute, co-director of the American Heart Association Tobacco Regulation and Addiction Center, and a distinguished university scholar at the University of Louisville. He was awarded his PhD in chemistry from the University of Kanpur in India, and he conducted postdoctoral research at the University of Texas Medical Branch in Galveston before joining the faculty at the University of Louisville in 1998. Aruni has received numerous awards and honors over the course of his career, including being named a Fellow of the American Heart Association in 2005. He has also received the President's Award for Outstanding Scholarship, Research, and Creative Activity from the University of Louisville, the Partner in Healthcare Award, the Outstanding Faculty Mentor of Graduate Students, and the Outstanding Mentor Award from the Conference of Southern Graduate Schools. And he was designated Research Exemplar by the Washington University in St. Louis. He hosts his own podcast called Elements of Nature. And with that said, Dr. Bhatnagar, welcome to the Anti-Aging Hacks podcast.
Well, thank you. Thank you for having me on your podcast.
I'm glad to have you on. I've been doing research on you over the last few days, and there was one particular lecture that I found, I believe you presented at Stanford, which kind of blew me away with how much depth you come into this field with, and we'll talk about what field we're talking about, but you are in the field of cardiology, and that is a leading cause of death in most countries and a lot of countries. And so I want to get into that, but what's your background and how did you get into this field in the first place?
Well, so I've always been interested in heart disease. I did my PhD on the pacemaker in the heart and how the heart generates its own rhythms. And so I was interested in doing that and trying to understand the basic mechanisms by which the electrical currents in the heart are generated. And that's what I set out to do. So one of the best places in the world to do that at that time was at the University of Texas and at Galveston. And so that's where I trained and did most of my work. But then more and more, I was drawn to the larger picture of what heart disease is and why it continues to be such a menace and kills more people than any other disease. And this has been the case since the early 1900s, and even in the last few years, when we had so many COVID deaths, heart disease was still the leading cause of death worldwide. Mm-hmm. And although we have different ways of dealing with heart disease, there are statins to prevent plaque buildup, and there are stents to open up blocked arteries. We do not understand why heart disease originates or starts anyway. So we have not been able to decrease the incidence of heart disease, which seems to continue to rise. So that prompted me to look into wider reasons of what may be contributing to heart disease.
Fantastic. And I believe you've been instrumental in developing this new field called environmental cardiology. Is that correct?
Yes. So it came about with the understanding that although for heart disease, there are proximal causes like your arteries blocked and there's plaque buildup, and then your heart rhythm is awry. But what are the distal causes, the things that are really leading to this disease? And more, I started working on it, understanding and reading and talking to my other cardiologists, that I realized that most of the disease originates from the environment. And so therefore we say that in order for us to understand heart disease, we need to look at this new way of understanding the disease. And that's why I started calling it environmental cardiology.
Great. And so what you're saying, Dr. Bhatnagar, is I've heard other people say that too, which is your genetics are not your destiny for the most part. It looks like environment is one of the leading causes of heart disease. How that actually manifests in the body, we can talk about. But I think what we're coming at is what leads to it manifesting in the body in the first place. And so what are some of the leading causes, I guess I should say, like what is in the environment? Is it the environment? And I heard you talk about this. Is it day and night rhythms? Is it more about the neighborhood you live in? Is it the country you're in? Like what is involved here?
Right. So first I want to talk about some of the evidence that this is an environmental disease. Mm-hmm. And the reason for that is that we know that people, if they live in the same place and if the environment changes, then the incidence of the disease changes. So for example, people living in China, we've seen that there has been 50% increase in the rates of heart disease in men in China. And that's accompanied by westernization of China, right? Mm-hmm. On the other hand, people who were in Finland in the 60s and 70s had the highest rates of heart disease in the world. And when Finland joined the EU and they had, fresh fruits and vegetables all year round, there came a greater awareness of this high toll of heart disease in Finland, that they took all these measures, and the rates of heart disease plummeted to lower than 75% of the rates that were in the 70s. So within the same environment, the rates of the disease can change. So certainly there are factors in the environment that are major contributors to heart disease, certainly, as you say, that our genetic code is not our destiny. Maybe our zip code is more important than a genetic code. Mm-hmm. And so that's what we were trying to work and develop a framework of understanding. Now, in response to your question about what are the various environmental factors that influence the risk of heart disease, there are natural factors, and then there are social, economic factors, and there are personal factors and personal choices. So in the environmental factors, we think primarily there are the cycles of night and day. So there are circadian rhythms that through which we are all aligned. And if we are misaligned, our rhythms are misaligned to the circadian rhythms, then there is an increase in the risk of heart disease. Likewise, there are seasons that change. We know that there are different seasons and have different risks. We also know sunlight is an important determinant of heart disease. We are like plants. We all synthesize chemicals, particularly vitamin D, when we are exposed to sunlight. And so lack of vitamin D is an important driver of heart disease. So these are all the natural factors that contribute to the disease risk. Then there are social factors. As you can see, there's socioeconomic status. There is the built environment. And one particular area that we've been working in depth is proximity to green spaces. So people who live in areas that are more green are healthier, have lower rates of heart disease than people who live in less green areas. Then there are features of the built environment, how cities are built and how we live in those cities can affect our disease risk. And then finally, we live in the same social networks, but we still have our own micro-personal domains, right? Environments that we create ourselves in a house, in our surroundings, and the type of choices that we make or the circumstances we are in. For example, smoking and alcohol and lack of physical activity, changes in sleep or lack of sleep. So all these personal habits or choices have a huge impact on the risk of heart disease. So all these environmental factors together and in some complex ways that we still don't understand, determine the risk of heart disease in one specific individual.
Wow, that's when you layer these things on, there could be so much going on, right? As you mentioned, like the sunlight might be affecting a little bit of your epigenetics, so to speak, or your environment in your body. And then come the other things that you just discussed, the socioeconomics, the personal choices you're making day in and day out. So in terms of, if we look at the last 100 years, and I know you touched on this a little bit, but is that the environment and how we are just appearing in the world and acting? Is that why the incidence of heart rate's gone up so much?
Yes. So if you look at data from several countries, for example, if you look at pre-Second World War England, right, you find a heart disease was relatively rare, and that it was mostly confined to people who were rich and less physically active, and it was thought to be a disease of the rich. After the Second World War, when they were rations and soldiers were given cigarettes with their military rations, people started eating more salty food. There was traffic in the cities, buses and trains and so on. So we see this exponential growth of heart disease. We have somehow, with industrialization, created environments in our cities in particular that are not conducive to health. We have introduced lights, so we are now 24/7. We have lights around us, which is not a good thing, right? So our circadian rhythms are perpetually misaligned, and then we have started eating a very wide range of processed food, right, which has contributed to the high incidence of heart disease. And then we have managed to pollute our entire planet. If you survey the planet, there isn't one pristine, unpolluted square mile left on this entire planet, right?
Wow. Yeah.
Even if you go to the remotest place in Antarctica and you look at the polar bears, you find there's like lead and arsenic in their bones. Wow. So we managed to corrupt and pollute all corners of the globe, and that's impairing our health and adding to the burden of chronic disease.
I see. Yeah, that makes a lot of sense. Okay, let's dig a little deeper into each of these, and I have a lot of follow-on questions for you as well. In terms of at the highest level, when you talk about the circadian rhythms, light being an important factor, and then those affect your sleep, of course, which then gets into your personal choices too. But at the circadian rhythm, when we have these lights in the cities and we're staying up late and the body doesn't know what time it is, I know that affects your sleep, and then sleep is related to an impaired metabolism. You have a high glucose that can happen because of sleep, which can lead to obesity. But I didn't know that there was a direct or indirect link to heart attack, which now that look back, it makes sense because everything's related to everything else. But what is the circadian rhythm specifically? At what level and how much effect does it have on heart disease?
So it has a very strong effect. We know that people who are shift workers and who are in transmeridian flights have at least twofold higher risk of heart attacks. We know that even acute sleep deprivation could cause an increase in your blood pressure, and it could precipitate cardiovascular events. So although there is no specific quantification in terms of percent, we do know that there is a high cost. Even in young people, like you mentioned, if you take 30-year-olds, perfectly healthy, and you put them in a room and you don't let them sleep for 3-4 days, they become insulin resistant and their glucose control is perturbed. So there are these acute effects. The other sort of interesting aspect is that most heart attacks happen early in the morning, right? And so there's a rhythm to it. And there's an interesting anecdote of the people who are from Japan who are vacationing in Hawaii. So when they have heart attacks, their heart attacks are early in the morning, Japan time. Okay, and then when they are in Hawaii for a week, then they start having the heart attacks in early in the morning, Hawaii time, right? So there is increased vulnerability at a certain time early in the morning where there is greater tendency of the blood to clot. and so there's a greater risk. So not only the light and day exposure, but also exposures time the vulnerability window. We also know that people who are actually have heart attacks and who are survived them, their recovery is impaired if the sleep quality is affected. If they are poor sleep and they have misaligned rhythms, then they have much poorer prognosis than people who are better aligned in the circadian rhythms.
Okay. So step one, get your circadian rhythm aligned as much as possible as your lifestyle or your job permits. And if you need to find a different job, then that's an option available to you, thankfully, in this new world and time that we live in. Okay, so that's number one. Number two, I think you mentioned, is more local, meaning the country, the city, or the neighborhood that you live in. So let's say, in most of the world, I think the population is now moving to the cities in vast numbers just because of the economic opportunities and just all the other benefits they can get from living in a big city, right? So how can we take what you're doing into account and try to live the best we can in a larger city? I'm not saying Shanghai or Mumbai, because those are pretty polluted, but maybe like a second tier city, right? Let's say in Austin, Texas. Is there a way to live in Austin, Texas and not be exposed to a lot of these problems?
Yes. So what is it in urban environments that contributes to disease? So I think their number one is air pollution. And in addition to that, there is noise pollution and light pollution. And these are ubiquitous features of urban environments, whether you're in Shanghai or you're in Austin. And so the other feature is lack of green spaces. There is something in our biology, and we call it the biophilia hypothesis, that our mental states, our psychological well-being depends upon interaction with natural things. We have this natural affinity for things that are of nature, such as trees and plants, but also cats and dogs and other living things. Even houseplants can make a difference. So people who live in cities, who live in greener areas, have much better health outcomes. There was a long study showing that, this is the nurses' health study from Harvard, showing that nurses who live in more green spaces have 12% lower risk of mortality than nurses who live in less green spaces. We have even found with cancer that people who live in more green spaces survive cancer much better than people who live in less green spaces. So greenness is an important issue. And I think if you live in green areas in urban environments, that is much beneficial to health. And there is this very active movement around the world to make cities as green as possible. They are now even creating forest cities in China. There are plans that are people putting in high rises in Milan to make our environments more natural and more green. The other thing that green things do is to clean the air. So we know there are 7 million premature deaths per year in the world because of exposure to air pollution. And most of this is derived from traffic, but also industry and burning and so on. And that's a major killer. Now air pollution kills more people than smoking does, right?
Wow.
And we also know that about 98% of the population in the world lives in areas that exceed the limits of what we consider relatively safe of air pollution. So it's a general problem of the industrial age that has had widespread consequences. So then there are issues of noise. So certainly noise is a big disruptor, disrupts sleep, disrupts attention, causes irritation and stress, right? So if you live in cities that you are exposed to all these urban factors, the best way to avoid this sort of additional burden or risk of disease is to live in places that are greener, that have darkness in the night, that have low noise levels, that have low levels of air pollution, which is, again, as far away from the roads as you can. We know that between, I think, 50 to 150 meters of a major freeway is where the major risk is. So you should not be living next to major freeways. away from that, and in quiet, dark places. Those would be one of the few things that we can do to minimize the risk of urban environments.
Okay, well, those are really practical tips that I think anybody listening to this show can incorporate in their lifestyle. And if you happen to live, let's say when kids are young, they like to live in downtown and, party at all days and all times of day and night, which is fine. But as you start to, worry about your health and get a little bit more maturity in this area, I think it's really wise. All the tips that you gave us: live 100 to 150 meters or yards away from a major highway, stay away from noise, stay in an area which gets dark at night, so it's not lit up the whole time. And also preferably live near something green, live near a golf course or a park. That's doable. And even in a major area where you cannot control for air pollution, you can control for some of these other things.
Yeah, and you can have greenness in your yards. I mean, we know that, again, within 100 meters of your house, the areas of high greenness, those have the maximum impact, right? And trees have a maximum impact. There was one study that shows that putting one tree in your backyard is equal to increasing your family's income by $25,000.
Wow.
The health equivalence of improving that. So it makes a very large difference if you have greenness surrounding your residence.
Mm-hmm. Sounds like an old Chinese proverb: plant more trees, make more money. Yeah. Okay, fantastic. Thank you, Dr. Bhatnagar. Those are really good tips. Let's move on now to the third area, I guess, which you talked about. And we'll touch on socioeconomics too. But let's do that first. Let's talk about socioeconomics.
Right.
Yeah.
So there is, of course, across every study that we have done, others have done, socioeconomic factor is the single most determinant of your health. It depends upon how much money you make, how much education you have received, and that makes the biggest difference. In terms of heart disease and adult health, the single most important factor is your mother's terminal degree. Okay, so mothers who are educated have the biggest influence on your health, because it may be, we don't know because of why, but maybe food choices, maybe places to live, whatever the reasons are. The socioeconomic status is very complex and difficult to define, but its impact is undeniable. It determines what actions you take, the type of life you lead, the choices you make, your access to healthcare, your access to medical information, your access to healthy behavior. And most importantly, which we are learning now, is the peer network. So if rich people stay with rich people, and the poor people have to stay with poor people, and that's this disparity that's been permeated in our society. Similarly, others have reported that thin people seem to hang around with thin people, obese people have to hang out with obese people, people who smoke hang out with smokers, non-smokers hang out with non-smokers. So all this health behavior is what we call transmitted through social networks, right? And so if you have an obese friend, then your chances of being obese is 50% more than if you have a non-obese friend, right? So those social networks have a very strong influence. Similarly, if you have friends who are always talking about healthy eating, who are eating salads and fresh fruits and vegetables, and who shop at Whole Foods or whatever, they have health promoting habits and don't smoke, don't drink too much, then if you're around such people, you tend to imbibe the same characteristics. And so one of the reasons that socioeconomic status is such an important determinant is because it affects the characteristics of your social networks. And so that makes a huge impact.
Yeah, that's amazing. I'd read about how having an obese friend increases your percentage chances. I didn't know it was 50. That's high. I believe it. What's interesting is that the people that are the most healthy at this time, I'm looking around in the country, they live in the most densely populated areas like Los Angeles or New York or Brooklyn, right? There's these, or Austin, I would even say. There's not like and I know this concept is starting of community of people living, outside the major cities where they're super healthy. But all the big healthy stores are in the middle of major metropolises. So let's move on to
So one comment about that. So remember, I was saying that before the Second World War, only the rich people had heart disease. After the 50s, and we don't know what happened, it switched. Only the people with the lower socioeconomic status have heart disease, but the people in the upper status of the socioeconomic distribution have low heart disease. So it completely reversed. And one of the reasons is people who are well off have better means. They live in dense cities where you walk, and you go places. You can have more healthy choices in your foods, right? And you have better sleeping habits and so on. So whatever the reason are, that the people with higher socioeconomic status tend to be healthier, at least in the United States.
Mm-hmm. Even though they're living in bigger cities, which come with the problems of pollution and noise and all the other things you talked about, right? Lack of green
Right. So
spaces.
there was a really interesting study, and it shows a very direct relationship between obesity and population density. So the more dense areas you live in, the less obese people are there. And that may be because you have to walk to the grocery store, you have to go to the bus station, whatever, and you run away from people who are going to mug you, whatever it is. you have to be active, right? You cannot be sitting in your car and driving 20 miles to Walmart to get your whatever popcorn. So that's sort of the whole lifestyle is different living in dense cities. And we've seen this in Europe, and most of the dense European cities, our populations are not severely obese, but there is high incidence of obesity in rural areas, and because there is limited chance for physical activity as a matter of everyday living.
Very interesting. Okay, cool. Let's move on to the next item, which I wanted to discuss with you is personal choices, be that diet, exercise, smoking, vaping, e-cigarettes, drinking, whatever you're doing in your lifestyle, and how those are affecting cardiovascular risk.
Yes, so our personal environments that we create are, in some sense, our choice, but sometimes just circumstance. But the greater sort of understanding is that we can only choose what the society offers us, right? So, like I keep telling my students, so Socrates cannot be smoking because there were no cigarettes in the agora. So only when we make these things available socially that people can choose. So in personal choices, there are two main things that affect us. First, of course, is physical activity. It's extremely critical. We now say that sitting is the new smoking. So it is killing as many people as smoking was killing. And we see that there was a decrease in heart disease because of lower rates of smoking in the United States, right? But at the same time, obesity increased. And that erased all the gains that we made from quitting smoking. And now our children will be the first generation since the 1900s who will not see an increase in their lifespan or life expectancy. Every year we've seen an increase, and now that increase is stalled, and largely because of obesity. And there are two reasons. One is physical activity, which we don't do as a matter of everyday choice. And the second is food. And this preponderance of processed food. A friend of mine estimated that if you go to a modern grocery store in the United States, about 80% of the food things that are there in the grocery store have zero nutritional value. Okay, so if everything that's in the aisles has no nutritional value, everything surrounding the aisles is food. Okay, so if you are going to make choices of, if you are rushed for time, you're low on resources, you tend to buy processed food that's easy to cook and make. You're not going to buy fresh fruits and vegetables that are difficult. So choices of food are critical, and those are determined by a lot of different social factors. Advertising, TV commercials, again, social networks and such. So these choices that we make have more impact on our health than anything else, not even the natural and social environment. This is the most powerful influence. Second thing, physical activity, that it's so important to be physically active. If people live in neighborhoods that have walkways around them, their parks are going to be healthy, and that makes a big difference. We know choices, of course, we all know smoking is bad, and that causes heart disease. We've done a lot of work on looking at why, and also this new sort of pandemic we call of vaping So for so many years, we had almost decreased smoking rates from 60, 50% down to 10, 12%. But in the last 5, 6 years, vaping has taken off. And again, it has eroded all the gains that we have made in erasing tobacco from a society. And it's come back with a vengeance. Now we see, like 15-year-olds, 20-year-olds, they're so addicted to nicotine, they get up in the night to vape, and that's sort of an addiction. We do studies and we tell people, these are young kids, they are like about 18, 19. We tell them that please come to our study, but don't vape 6 hours before you come to the study, right? So if the study is at, say, 10 a.m., then maybe they get up at 6 a.m. They put an alarm and they get up at 6 a.m. to vape because they know that they won't be able to vape for the next 6 hours. And that's sort of, so this level of addiction that we have perpetuated in the society is really alarming. And we know nicotine increases your blood pressure, increases your heart rate, and lowers your heart rate variability. So even though e-cigarettes have been touted as safer alternatives to smoking, they're not entirely safe, and that they could contribute to the higher rates of heart disease in the future. So these sort of choices that we make have an important bearing. It has been estimated that if we make these choices, the right choices of food and good food, nutrition, physical activity, and no smoking, we can cut down the rates of heart disease by 70, 80%.
70, 80%.
Yes.
Wow.
There is a program from the American Heart Association called the Simple Seven, the Life Simple Seven. So you do the 7 things: eat low salt food, you're not smoking or vaping, and you have physical activity and you have good nutrition, then your heart disease rates are dramatically lower.
Wow. Okay. Fantastic. And, there's so much talk about diets and it's super confusing of what nutrition to adopt. And I typically tell people is to just eat whole foods, eat organic, natural whole foods as they would be found in nature. And you can prepare them however you like. But if that's your first step, if that's where you start, then you're doing very good. Avoid the middle aisles in the grocery store, because that's where, as you said, all the processed foods are. Are there any particular heart damaging or heart healthy foods that people should either stay away from or gravitate towards that you've come across?
So food is a very complex issue, and nutritional science is, I still think, quite underdeveloped. So because we cannot do randomized controlled trials with foods, right? So people are really wary of any nutritional advice. And because one week it's one thing, the next thing that's not the good thing, and so on. So it's always precarious to have any nutritional advice. But there are certain things that we should and must keep in mind. So some of them, for example, is exactly what you said. We need to eat real food and not fake food or made up food. Okay, so Cheetos is not real food. Okay, right? And so we cannot be eating Cheetos or even other types of food that they make up, chips and things like that. So that's not real food. So then real food is that, and then there's of course heavy emphasis on fresh fruits and vegetables. Some of the things that we think, especially for the heart, are critically important are things like omega-3 fatty acids, and we know that omega-3 fatty acids are one of the most potent foods in decreasing the incidence of heart disease. We know that people who have a diet rich in omega-3s do much better in terms of heart attacks and in terms of heart disease. We know that vitamin D is critically important. And I don't think, even if you drink fortified milk, there's enough vitamin D in food to really make up for the lack of sunshine. So I think that is critical as a nutrient. Then, of course, we know that there are a whole range of what we call antioxidants or complex molecules that come from, fresh fruits and vegetables, especially colored fruits and colored vegetables, the greens, the reds, the purples, the yellows, and all those things make a big difference. But most importantly, and this is the point that's most missed by nutrition advice, just the amount of food. Yeah. In the end, it may not even matter what type of food you eat. You just eat 20% less of what you would like to eat. And that has repeatedly been shown in many, many studies to prolong lifespan, to sort of delay aging, to promote heart health. Just eating less food makes the biggest difference.
Agreed. And anybody listening to this show already knows about fasting and about eating less. It's so critical to a longer life. Okay, one more question, then we'll get into some of the mechanism of action, and then we're coming up on time. So, in terms of risk for heart disease, when I know there's a lot of, in this new world, people are moving across countries, across continents for upward mobility, for a better life, whatever that may be, is there genetic traits or factors that they carry that might belong better in the old environment, in the old country they were in, rather than the new country? For example, somebody from Africa moves to Sweden or vice versa. Are they at a disadvantage when it comes to heart health?
So that's always a little precarious question, isn't it? And it seems to smack of certain, adaptiveness and racial differences. But there is biology to support that. Some people are adapted in one environment and others in other environments. Certainly, if people from Northern Europe and decided living in Africa, it would create huge problems in terms of excessive exposure to sunlight, higher rates of cancer, and so on. The converse is also true. So if people living in Africa go to live in Northern Europe, they are actually much more prone to disturbances of circadian rhythms and light and dark cycles. People who live in equator or even in sub-equatorial places like the tropics, which people who have dark skin colors, if they move to a northern climate, they have a difficulty in adjusting to changes in cycle length of the day and night, because they've been adapted to areas where there's no change in daylight times, whether summer or winter. Where the northern latitude people have done that for more than several millennia. So there is a much greater cost. They cannot reset their circadian rhythms as well. And similarly, people who are living in, like, for example, Boston or Stockholm, then you're going to have, if you have dark skin, you have to spend a lot of time in the sun to make up for that low levels of UV light in northern climates. And that is an additional risk. But otherwise also, if people who are living in more green environments move to more arid conditions and not adapted to cold and arid climates, there could be some additional risk.
Mm-hmm. Got it. Well, thank you for that. Now let's move on to, from what I understand, how heart disease manifests. And I'll just share very quickly. From what I understand, high cholesterol levels in LDL or even other apolipoproteins in the blood, when there's inflammation in some of the arteries, that these cells get there and this fat goes inside the endothelium wall, and then it can create these more and more cells called foam cells, but at some point they cause a plaque along the artery. At some point the plaque ruptures, and then you have a heart attack. So that's, from what I understand, the mechanism of action is the inflammation, which starts everything, all the things behind it, right? Is that still correct with the work that you're doing? Or how does that overlay, or how does that provide more context into this pathway that we understand?
Yes. So yes, that is, I think, one of the, I would say, the smoking gun for precipitating heart attacks. Of course, plaque rupture is one mechanism. The other mechanism is plaque erosion, where you do not really have so much, buildup of fatty plaques in your arteries, but your endothelium just sort of erodes, and you have sudden cardiac death. That we see that a lot in women, especially women smokers, with very little risk, and they get plaque erosion and precipitate sudden cardiac death. So all of this inflammation is triggered by a variety of different factors. For example, continuous stress response, right? So if you are in a place where there is, more greenness, where you're less anxious, where you are, less perturbed, then you would have lower levels of these sort of anxiety-producing hormones. But the single most bigger factors, which I think is even more important than cholesterol, is blood pressure. Blood pressure is one of the leading killers in the world. It's a silent killer, and it is very, very prevalent. And if there was single important thing that anybody could hope to do to prevent heart disease is to lower blood pressure levels. And so, like you said, when you have stresses on the arterial wall, then the arterial walls are cleaner. That's why exercise helps. It lowers your blood pressure, changes your flow. But then there are small areas in the blood vessels where if there's not good flow, they form little eddies. And in these little eddies, plaques generate, and that creates the nidus for the plaque formation. But if you have good flow and the blood circulates well, like with exercise and so on, that you would have less risk of developing these plaques. So the critical factors, again, in preventing plaque formation is to have good flow, which is to maintain a very good circulatory system. And then finally, insulin resistance. It creates this, it promotes plaque formation. It creates unstable plaques that are more likely to rupture. Diabetics have 2 to 3 times the risk of having heart attacks, right? So that's because of the changes in insulin resistance. So that's where the metabolic component comes in, food comes in, exercise comes in, sleep comes in, all those other factors.
Got it. So that's how all of it ties together. Now, Dr. Bhatnagar, I also understand that these pollutants in the atmosphere and the air, in our water, they cause oxidative stress in our bodies with reactive oxygen species. Is there, and a lot of people propose, taking antioxidants, high doses of vitamin C, vitamin E, spirulina, astaxanthin, and others that might help negate or mitigate these ROS radicals in the body. Is there any evidence from a heart standpoint that taking high antioxidants during your day, outside of from natural food sources, can help mitigate some heart disease?
Well, unfortunately, no. Most of the trials, vitamin E trial, I think there was a trial with, C. There have been other antioxidants people have tried, have not really shown a robust effect of any of the antioxidants. And the thing is that these ROS are not only causing damage, they're also required for signaling. That's kind of how the cells operate and tell each other whether they are sick or under stress. So it's a very complex area. And we do not know that there is any sort of straightforward remedy that you could say, let's just all take, vitamin C and vitamin E and all our problems will go away. There are certain claims of things like, I don't know if you heard of the NADH therapies and so on, that you can take NADH and that will rev up your metabolism and then change your epigenetic programming and maybe conducive. But as such, individual vitamins don't make a difference. But they still, I think there's still a strong case to be made about the range. For example, if you take, say, vitamin E, so it's the tocopherol, right? So if you just take tocopherol, you will have high levels of tocopherol in the blood. But there are other forms of vitamin E. There's called the other phenols, the trocotinoids, and so on. There are alpha tocopherol, delta, beta tocopherol. So you need the whole range, right? So you can't have just one particular antioxidant. So it's like you're fighting a war and say, I can only fight my war with only the infantry, right? Only foot soldiers. No, you need the whole army. So we need to have really a whole range of antioxidants, and those are best obtained from rich, nutritious food rather than individually jacking up one antioxidant over the other.
Well said. Okay, thank you. That was great. Thank you so much for all the information you shared. Last question for you: do you have any other longevity tips from an accomplished researcher such as yourself? What would you tell the audience?
That's a tough one. I would think that interaction with nature is one that could help us promote longevity and live in what I like to call, which sounds a little goofy, is like be in harmony with nature, right? So in some sort of, in a way that we have a conducive, harmonious relationship with the natural world around us. No matter how much we pretend, make cities and houses and, whatever, glass windows, we cannot divorce ourselves from nature. And listening to it, adhering in some sense, you can call it obeying the laws of nature, the night and day cycle, the food that nature offers, not to mess with it too much, right? And being in nature, interactive, physically active, is one of the ways in which we think we can live at least a healthy life, if not a longer life.
Mm-hmm. Fantastic, Dr. Bhatnagar. Thank you so much. Folks, there you have it. Lots and lots of practical tips that you can use to reduce all the environmental factors that may be causing worsening of your heart disease or your heart condition. And if any of your loved ones have this condition, please feel free to share this interview with them. With that said, Dr. Bhatnagar, thank you for coming on the Anti-Aging Act Show.
Thank you very much for having me.